Assalamualaikum and best regard. I, Juliana binti Maknayan from company Foods Burger, would like to propose about a presentation on new service to help recovery after PKP. The vision of this company is to help heal themselves, the spirit of identity. Will the mission of this company is for senior citizens to stay healthy and able to survive and fight the effect of COVID. This is because our company found that most of the victims of this COVID epidemic are from the elderly and many deaths are from the elderly as well. It also has a hard impact on the elderly in terms of their physical and mental, where they will feel desperate to continue their life because if they are infected, they have a very high risk, especially if they already have other chronic diseases such as diabetes, high blood pressure, heart and kidney diseases. Based on a study conducted by our company, the elderly are more likely to be admitted to the emergency ward and give respiratory assistance, and if breathing becomes low, they will be comatose and does not guarantee them to regain consciousness. As such, we Fatsburger have decided to do a service to help the community health center and safety division. Counseling talk season are prioritized for the elderly and are applied with awareness of the dangers of COVID-19 in present. Our company went to introduce new service for them because from the Ministry of Health Malaysia, Director of the elderly to increase their moral and spiritual to face this COVID epidemic. Our company plans to provide counseling season for elderly. Counseling season will be held at the district and state level. Counseling season will be provided by professional bodies such as MOH. General of Head Dr. Nur Hisham Abdullah said the two age group that face high risk are the elderly aged between 55 to 59 years and 60 to 64 years. He said it was the result of the ministry study by matching the population for each age group and the incidence rate of COVID-19 per 100,000 individuals in Malaysia. The elderly are a high-risk group for complication and death due to COVID-19 infection due to age factor as well as chronic diseases. This is a global issue facing the countries affected by this epidemic. Statistics show there are two age groups of the community with the highest COVID-19 positive case compared to other age group. It covers 20 years to 24 years and also 56 years to 59 years old. This can be seen in the chart of the number of COVID-19 positive cases by age. However, when the statistic of the number of COVID-19 cases are matched with the population for each age group, it can be clearly seen that the incidence rate of COVID-19 per 100,000 population in Malaysia is the highest for the age group 55 to 59 years and 60 to 64 years. A total of 80.7% of deaths were found to have a record of chronic diseases such as diabetes, high blood pressure, kidney, heart, and others. It found that the recovery rate and prognosis for COVID-19 infection is better if treatment is started early. Therefore, it is very important for elderly group to seek immediate treatment. It is necessary even if they have only mild symptoms such as fever, cough, flu, or sore throat. Therefore, family members are responsible for making sure a few things about the elderly. They need immediate treatment if unwell, adequate medical supplies, and adhere to treatment appointment in addition to having adequate necessities. Personal hygiene practice should also be maintained, such as frequent hand wash with soap and water and practicing a safe social distance of at least 1 meter. To reduce the risk of infection, Dr. Nur Hisham encouraged senior citizens to use the Postal Medicine Delivery Service (UMP) during the period of the Movement Control Order (PKP) in force. Through this approach, he said, the supply of medicine for related diseases can be sent directly to the home of the elderly without requiring them to visit a nearby hospital. We are also concerned about the health of the elderly who live in care institutions for the elderly, especially for institutions that have many residents and have difficulty practicing safe social distance. Since the implementation of the first phase of the PKP, which began on March 18, 2020, various forms of psychosocial service for the general public affected by the COVID-19 scenario and this moment control introduced have been provided by professionals including psychiatrists, psychologists, counselors, and social workers all over the country. Their services are provided in the form of psychological and emotional assistance, crisis counseling, season coaching activity, and so on. However, given that the COVID-19 experience is a new experience by more countries, including Malaysia, in managing large-scale communicable diseases pandemic, the average provision of psychosocial support service is quite reactive and should be improved to be more proactive in preparation on the front. For example, the provision of counseling service in crisis situations such as COVID-19 cannot be done according to customary practice. Due to factors of movement limitation and social imprisonment demand during the PKP period, this service is attempted to be delivered through platform not yet recognized in the Consular Act 1998 at 580, such as community via telephone or use of social media such as WhatsApp, Telegram, Facebook, etc. As a result, all of them platforms marginalize the face-to-face element that is at the core of effective counseling service. Perhaps in a crisis situation such as the COVID-19 pandemic, an online approach that does not include this core element, for example, conducting sessions using video conferencing methods, could be considered for recognized by the authorities to meet the need to support the well-being of the general public. This uncertain. In addition, the patient to provide psychosocial support service in this urgent time sometimes lead to a tendency to set aside the basic of a service provided. As a result, this situation can be confused to many, especially those who really want help. As already mentioned, since the COVID-19 outbreak spread rapidly over the past 2 months, various forms of service have been provided by all helping professionals, including by those who are not skilled but have a high willingness to help. For example, counseling service cannot be arbitrarily provided by any untrained individual. Therefore, any part such as non-governmental organized or private agency like us should be careful when offering their respective service. Perhaps what is offered is psychology, emotional management counseling, or guides that a clear crisis counseling season that can only be handled by professionals. In addition, the lack of understanding of the basic of voluntary counseling service also leads to a perception that counselor professionals do not play a role in this difficult time. The face it, since the COVID-19 pandemic spread and the PKP period come into force from mid-March, many counsellors from all companies have already been at the front of the second day to provide psychosocial emotional assistance to all practice in need of support. However, because of its bilateral nature, the willingness of those who need help to come forward for help is equally important. In other words, it is unfair to create the perception due to negligence in understanding the basic of the service as if counseling professionals in Malaysia are not making any meaningful contribution in the fight against the COVID-19 pandemic. In conclusion, just a frontliner works in the healthcare industry and law enforcement security personnel are at the forefront. Assistive professionals such as counselors, psychiatrists, psychologists, and social work also work together to develop psychosocial and emotional support systems that sustainable to help all practice it need.